Good morning for those of you who have joined us. We're going to give another minute just to allow people time to transition and join this meeting. Good morning for those of you joining us. We'll get started here very shortly. Well, I think we'll go ahead and get started. We may have people joining us later, but good morning and welcome to the Waiver Reimagine Advisory Committee, or RAC. This is meeting 5. Thank you for joining us today. We can go to the next slide. Welcome, everyone. Just reminding people of meeting practices. I won't read through all of these, but do be mindful that when speaking, if you could reintroduce yourself and who you represent, being mindful that we do have captioners with us today, so we need to speak slowly so that they can capture your thoughts that you're sharing. Everyone has the right to share, and you can read the other meeting practices, and we can go to the next slide, please. Also, just reminding people to help save bandwidth, you don't need to have your camera on today, so you can keep that off. Please mute yourself if you're not talking or sharing. And we're here to have an open mind and hear from DHS today. We can go to the next slide. Here's our agenda for today, and just welcoming people who are following us on YouTube live streaming as well. We'll start with our welcome and grounding, which we're doing right now, and then have a little bit of a reminder of the last meeting when we met in August. And then Megan is going to talk us through some budget information today. That will take the bulk of the meeting, and then we will wrap up at the end. Okay, next slide, please. So our objectives for today, for those of you who are RAC members here joining us today, understand the development of the support range model and service mixes. Be prepared to participate in the update of the budget model in 2023 and beyond. And for DHS staff, many of whom are joining us here today, they will provide understandable background on support range model and service mixes, and they're here to listen and note questions for future materials and meeting topics. We can go to the next slide, please. So now it's my pleasure to introduce Matt to you, who's going to take us through an August meeting recap. Matt, are you able to come off mute and join us?
Hello, can people hear me?
Yes.
I'm having difficulty getting my camera to work. I apologize, otherwise I would be on camera. Hi, my name is Matt Knutson. I'm a supervisor of the waiver policy team in disability services, and I use he, his pronouns. And I wanted to give background about the August meeting. So during the August meeting, members provided input on how to use the guiding principles the group has been working on since April as policy development work begins. And to summarize, members would like to use the guiding principles as a guide for decision making, and they'd like to keep the principles at the forefront of policy development. So that is an outcome of the meeting. Advisory committee members also shared concerns related to implementing a two-waiver system. And the concerns included, but weren't limited to, services by waiver not meeting needs regardless of a setting. And other concerns were moving between waivers could be cumbersome. And another concern was individual budgets incenting congregate living versus own home. Those were the primary concerns we heard. Policy development work began with members providing input on the names of the two new waivers, which we'll continue working on. Detailed information, including policy recommendations from the August meeting, can be found in the published meeting notes. Next steps are, at our December meeting, the Waiver Reimagine Advisory Committee will have an opportunity to provide written feedback on the names of the waivers and eligibility and services by waivers. So we'll look at eligibility and services by waiver. The feedback will be the basis for group discussions at the December meeting. So thank you for the opportunity to provide this update, and I'll watch for questions or anything else in the chat and as the meeting progresses.
Matt, thank you very much for that. And we can go to the next slide. And then it's over to you, Megan.
Perfect. Thank you very much, Leah. Just to introduce myself, my name is Megan Lindblom. Sorry there. And I am the Program Integrity Supervisor here at the Disability Services Division, and my team oversees the individual budgeting portion of Waiver Reimagine. Before we step into the content today, I just want to call out things that we've already connected with you, RAC members, about. But we have had a timeline update for phase 2 of Waiver Reimagine, and the implementation now begins, or is anticipated to begin, on January 1st of 2026. We reached out to all RAC members on 9/20, so if you haven't seen that email, please check your inbox. And a statewide e-list was sent out on 9/22 in this year, 2022. The websites and frequently asked questions are currently being worked on to be updated and address some of the questions that we've got since that announcement went out. Next slide, please. So before we jump into our budget fundamentals session today, I did want to take just a moment to pause and update the whole group. Hannah Lamb, who many of you have worked with closely, and she has been kind of coordinating this group, has taken a new position in disability or in the Department of Human Services, and we are so excited for her. But as we're transitioning and getting her work moved over, we would just ask that you connect with waiver.reimagine@state.mn.us. She has been a great partner in this project, and we're so excited for her next adventure to go on. So if you are connecting directly with her, we just ask you to connect with our inbox, and we will make sure everything gets taken care of. Thank you. And so shifting today to our content, we're going to have a budget fundamental session, and you're going to be hearing from me a bit today. So next slide, please. So today's meeting is going to be an information sharing and learning session for members. We, DHS, and it's going to be me today, is providing more in-depth information on the budget methodology development, the proposed budget methodology that we've talked a little bit about in previous meetings, and then the future work, especially taking into consideration the extended timeline and what does that look like not only for DHS, but for RAC members in the larger community. And we just wanted to take this time, and we know that sometimes long listening sessions can be difficult, but it's really critical that as a group, we all have a shared understanding of the information that we're going to present today, because it's going to directly affect the next steps and the diving into the policies and the decision making that we'll all do together as a group. So thank you. Next slide. So Just because today is a listening and learning session does not mean that we don't want to hear from you. So we ask that throughout this meeting, if you could keep track, whether written or however you like to keep your notes, of the specific questions you still have. We're going to ask for those in the after meeting evaluation survey so that we can collect them and help us understand where we can focus in further and answer questions and provide more clarity. If the evaluation shows that there are still a lot of questions about the methodology, how it works, what's going on with it, or places maybe we weren't as clear as we intended to be, then I think what we'll do is set aside some time and find a time that works for us all to have some office hours and a further discussion about the conversations and the questions that you'd like to have. I will say, if you have questions, and just again, continue to keep them in your notes, however you like to take those. If we have time at the end, we may be able to answer some of them. So I would say keep a good list, make sure they're really specific so it helps you remember the question that you did have. And if we have time today, we'll get to some of those and we'll definitely be asking for them in the evaluation survey. Thank you. Next slide. And one more level setting, and then we'll get into content. But we always find it really helpful to stop and pause and talk about the terms to know, or our vocabulary words, if you will. The things that, we use as common language, but maybe kind of jargony or may mean different things to you. So one way that we can start to bridge our gaps between our understanding and yours and how we can create collaboration is to talk about the terms and how we're going to use them, right? So when we talk about an individual budget model, that and what we actually mean by that is the way that the cost of a year of services and supports for an individual person who uses the waiver services is determined or figured out, right? So that model is how we get to the amount of funding, okay? A support range, we've used this term for a few years now, but let's really clarify what that is. And it is the level of a person's need based on their MinChoices assessment. It's not the scoring, it's not the budget. The support range unto itself is that level of a person's individual needs. The support range criteria, however, is that scoring, right? So we have a support range, which is a level of need support. And then we have the support range criteria, which is how that level of need is determined, right? So the scoring of a person's MinChoices responses to determine their support range. Another range, I know we should do better at naming these. If you guys have ideas, please let us know. But a budget range, that's the amount of money available to pay for the services and supports for a certain support range, right? So we're talking, support ranges are about the needs of individuals. Budgets are about how we fund and put money to those needs. And a service mix, which we'll get in a little bit today, is the amount of services and the rates of services that add up to a person's total budget, right? So just like we have support range criteria leading to a support range, those service mixes are what lead to a budget range. Okay, next slide, please. So just as a little level setting, if you weren't with us or you need a little refresher, June was a long time away. Let's take a look really quickly at what we talked about then. Next slide. So remember our June meeting was talking about slicing up the pizza, the different ways that with a finite amount of resources that DHS has been asked to work within, how do we make sure that we are creating equitable, accessible budgets for individuals themselves? And the conclusion that we reached and what we had talked about is those level-based budgets, right? And we see that graphic on the left side of our screen, that there are different levels of need for individuals and groups of individuals, as well as different levels of funding needed. Next slide, please. So a little bit more on that conversation that we had back in June, the strengths and the challenges. The strength of the level-based budgeting is that it can account for those errors or changes in assessment over time without being reliant on a few answers, right? Creating stability for people through the assessment process. It can be updated without affecting the entire system. It offers a budget range, and in some cases, it's a little bit easier to understand than, say, an algorithm-based budget. The challenges are it is less individualized or unique, right? Not everyone's going to have their specific budget amount like we're used to with CDCS today, but that overall there's a finite number or limited number of budget ranges that are available. And another challenge is that it can require additional data collections, which sometimes can add a burden to the system as well. Next slide, please. So next up, we're really going to take a deep dive and look at all of the steps that we've used here in Minnesota to create the individual budget methodology. There'll be lots of time for us to pause and move into the next step. But before I do that, I just want to take a moment to remind you, take specific notes, note where those questions are so that it helps you reflect and communicate with us where your questions or places of confusion might be. That both helps us understand how we can be better communicators to you all, as well as where we can do more to explain the concepts that are important to you. So just pausing there, but let's get into the next slide. Okay, so there's a lot going on here in this slide, but we wanted to make sure that we were visualizing on the left side of your screen the major steps that we have gone through with all of our budget developments. And we'll talk about that there's been a few rounds of this work now, and seeing how each one of those steps really are working and how they led to decisions. The one thing that I want to pause and make sure is super clear is everything I'm going to talk about today are part of publicly posted reports that are online. They can be really weedy and very full of information that sometimes can be hard to understand, or you may need to really sit and focus on it. But if you have read those reports, you will note that there is 9 steps to creating a budget. But for today's meeting and for an effort to make it a little bit easier for us to talk about and for everybody to understand, we condensed a few of the multiple steps together. An example of that would be step 4, finalize support range criteria. Previously, you may need to really sit and focus on it. Hello? If you have reports, you will know that there. Does someone have a question? No, sorry. That step 4, it was multiple steps that were really technical and also mostly led to that finalizing support range. So just to note, if you are digging into those materials online and you're like, hey, wait, there was 9, it's just for ease of reporting or to talk about today that we brought it down to 6. But yes, there are 9 steps. And one thing we really wanted to talk about too is on the right side of our screen. We started out with really central research questions, or the questions that we wanted this work to be able to answer, which is how many levels should there be? How does a person get assigned to a level? And then how much funding does each level receive? And at the heart of the answers of each one of these things really does start out with analyzing the min choices data that was available at each one of these process points, and as well as the service and spending data from the entire population of people on the waivers. So if we're talking about adults, we're talking about everyone who is 18 plus, who had a min choices at the different juncture that we have, and we'll talk about when we looked at each one of these. But we looked at the whole population. We didn't look at a sample. We didn't look at one population versus another. It really was all people who were using those waiver services. So just wanted to call that out. Let's go to the next slide and talk about a few more things, and we'll jump into each one of these steps and talk about them specifically. So like I hinted at, and before we really get into each one of these steps and the how, we want to make sure that you first understood that this has been a multi-year process and that there's been multiple budgets developed during that time. So we have that adult population support ranges, as well as a set of children's support ranges that were done separately for a number of reasons. But to call out, the adult support ranges and budgets were initially created in 2018, And the children's support range and budgets were initially created during 2020. During the 2020 year, we also went back and we revisited the adult support ranges and tested our assumptions and updated things as well as we had learned since 2018. Also, to call out, the processes were really similar. We took the learnings we had from 2018 and applied them to 2020, but due to the different populations, as well as factors like the COVID-19 pandemic, the processes were just slightly different. And an example of this really would be that in 2018, we had a heavy focus on being in person, moving around the state, meeting people where they were at. And in 2020, that just wasn't a reality. We did ask families and people with disabilities if that was something they were interested in, but a lot of the time what we heard is, hey, that's just not somewhere I'm comfortable. I don't have the capacity for that right now. And so we moved that fully into virtual engagement. Next slide, please. However, that does not mean we were limited in our stakeholder engagement. And I think this is a slide that we've talked about before, but I want to call it out again that we really have been talking to all facets of people that engage with our system really heavily, as much as we could, with people and their families. We also connect with lead agencies, other DHS staff, providers, and of course the legislature. And what we continue to hear, I'm so sorry, 1 minute, my dog is having a moment.
Ah, the joys of working from home. These things do happen.
I apologize so much. Unfortunately, my husband had to have emergency dentistry today, and I am here with a dog. So I do apologize, and he will be quiet in just a minute. I hope you all can appreciate as animal owners as well. So next slide, please.
Real life working from home situation. We all have it.
I know, thank you. Okay, so now I want to call it a couple of things before we jump straight into step one. But as you can see, we really want to make sure that it's very clear that each one of these steps and where we are in the process. So each time we move from one step to another, we are going to come back to this slide and reorient ourselves. That way we can make sure that it's clear where we're at in our process and we're not getting all jumbled up. And hopefully it also gives you time to, again, jot down some of your notes or any questions that you may have. So we are going to start on step one, and that was create the support ranges, right? So let's go to the next slide. Can we go to the next slide, please? Thank you. So there's a few facets to this step, and it's a pretty complex piece of work. So we wanted to stop and talk about maybe what we see as that, and then one thing that we've heard from people and how they see that as well. So when we looked to determine the support ranges, we again used that actual min choices assessment data, and we started to work through statistical modeling and a number of those statistical modelings to find naturally occurring groups of support needs based on all of the different models. And on the right side of the screen, you can see some of the steps we did there. We looked through a descriptive analysis statistical model. We then went through regression analysis, factor analysis, and latent class analysis. Again, those are very heavy topics and very complex. So they are reflected in the reports. If you have more, or if you have questions about them, let us know. But we didn't want to spend too much time trying to really figure out each one of those things. But one of the things we do want to call out with the statistical modeling, we started out finding those naturally occurring groups of support ranges, and then layering on and reviewing if there was any additional meaningful differences that needed to be accounted for. One thing we found was if they had higher behavioral support needs or higher health needs, that they tended to need more supports and they used more services as well. So I will see over and over again. I am so sorry. As we get there, I will be right back. We can go to the next slide.
Thank you, Mary, and thank you everyone for your patience. While we experience these real working from home challenges, I'm sure Megan will be right back.
Here we go. Thank you. Sorry. Yes, it's that time of year where I've got a road crew outside of my house with no warning, and my big protector of a dog is trying to make sure that we're all safe, even though we're up on the 3rd floor and there's not a whole lot of threat for us. So thank you again for your patience. These things happen. So as I talked about, we looked at the groupings and assigning those different groupings together or where those meaningful differences are. But a lot of the time, the question we get about the creation of the support ranges isn't necessarily how those groups were formed, but how those groups were scored. And so we wanted to take some time and talk a little bit more about that. On the right side of the screen, I'm fairly certain we have used this visual in this group's meetings before, but we do want to talk about how with the Min Choices assessment, we really took a comprehensive approach in that when we look at our general support need, which is that top box with the arrow on the right side, we were looking at not just a few questions that were flagged, but almost all questions in the general support need domain for Min Choices. When I say general support need, what I mean are the activities of daily living, or ADLs, as well as the instrumental activities of daily living, or the IADLs, right? This is really where we see a person's general daily support need come from. We also looked at the domains of that health support as well as the behavioral support. And so one of the things we hear a lot is, okay, well, you used a lot of questions. What does that scoring look like? And that's on the left side of the screen here. Here's an example pulled from the current Min Choices assessment. The question being, when doing simple meal preparation, this person needs no help or supervision, sometimes, often, or always. And I won't read the whole question there. But the scoring works in that if they need no help, that question would be scored a 0, right? If they sometimes need help, they would have a 1. If they often, that would be a 2, and always, that would be a 3. And nearly all of the questions in any of these domains are scored in this manner or similarly, and we add up all of the scores over the course of the Min Choices assessment. So let's see what that looks like at the final product on the next slide. And to call out, these are our adult Min Choices aggregate scoring, or summed up and totaled scoring. And these are the final ones. So these weren't the initial ones we found, but these are our final ones as of now. And we'll get to that as we talk about the future of our work. But when we look and we see on the left side of this table, we have all of the support ranges for adults as they are today. And then that next column over is called the general support need, which would be, again, those activities of daily living, or ADLs, and instrumental activities of daily living, the IADLs. And as you can recall from the last slide, we had that one question about meal prep, and a person could get a score of 0 to 3. And if we look at support range 1, we would see over in the second column there that a general support need score would be 7 or less. So even if that person had only a 3 for the simple meal prep question, then they would fall into that category. There could have been 0s for all of the other questions. And while it may not be likely, that could be someone's lived experience. And so we make sure that that scoring is including all and as many of the questions as we can. And we start to see it gradient up or move up stepwise. So if we go all the way down to 4 in our far left column and we look over 1, we see that that score could be 30 or higher. And that, again, that doesn't mean that a person would have had to answer 3 to every question. They could have had some 3s and some 2s and even some 0s, but we're looking at the sum of the score for those 2 different types of need, ADL and IADL. Okay? But then we also recognized, going back a couple of slides, that there are additional support needs for people who may have high behavioral support needs or high health needs. And that's where we get into the 4 left column. And you can see overall, each one of them are how they are scored and how we can see when we get into L and H, which are the categories that really do bring the higher behavioral and or health needs, you see how they are higher than those 1, 2, 3, 4 support ranges. And I'd want to call out here, sometimes we do get questions or concerns about the names of those different domains. You see psychosocial behavior, psychosocial emotion, so on and so forth. Those are the names inside of the Min-Choices assessment. So we want to be consistent with the names that we're using. However, we typically, when we're talking about the support ranges and scoring, we call each one of those 3 columns that are labeled psychosocial as the behavioral support needs. So again, sometimes there's a disconnect between the common language that we use together, as well as the technical language that can be used in our tools. So I just wanted to call that out. Okay, next slide, please. And so now we're moving on to step 2. And again, like I said, these slides are going to keep popping up, reorienting where we are within this process. So now we're going to move on to step 2, which is developing the support range descriptions. Again, take a minute as we move to the next slide. Write down any questions you have about the scoring or creation of the support ranges. I see we have some additional pet issues in the chat too. So thanks for sharing that with us, Pat. Next slide. So step 2 of our process was developing the support range descriptions. And these are widely available now, again, in our reports, in our legislative report. And what support range descriptions are a narrative tool using the Charting the Life course framework that really helps us understand what the support needs are within the overall support ranges themselves, as well as, and we really hope, a tool for people and their families to use ahead of assessment, ahead of support planning, to start to identify where they may fall within this process, right? It provides a plain language example of the support needs of individuals, which is really our goal here. And when we did develop these, we did checks and stakeholder engagement to make sure that the language we were using was how people would talk about things, that we weren't having any blind spots around how we could represent this. I will say a question we get around support ranges, and I'll just call it out while we're here, is oftentimes, and we hear this from lead agency staff often, of, so I have to read these and figure out where they fit in. And it isn't. This is not a support range criteria tool. This is not an access point to get into support ranges. These are simply supplementary supporting documents that help everyone in our system have a shared understanding of what to expect. Next slide, please. So step 3 is our first take on verification of the findings we have so far. And again, we're moving down our process and you can see where we are here. Again, just a reminder to write down any questions you may have. Next slide, please. So the verification, at least the first verification we did in step 3, was a really big process. And again, we did this for each one of the budget developments. So we did this both in 2018 and in 2020. But what we took was a very large scale survey that asked Minnesota experts with lived experience to come in and follow some of the same steps that we had done and make sure that if given the opportunity, they were finding the same things we were. And we did that in a survey format, which we took real data from people here in Minnesota through their Min-Choices assessment, and we de-identified it, so we didn't ever cross those lines that we shouldn't be crossing. But then we brought in an expert panel to review those cases and to look at how they themselves would put in the scoring criteria that we had talked about a little bit earlier. And through that process, it allowed us to see a very large take on how would Minnesota experts, people who are here on the ground, people and their families, people who are advocates from lead agencies, from providers, from DHS staff, do we all have an agreement or are we a little bit off, right? This is the place I like to say we got the real people in the room to make sure that all of that stats and those numbers weren't leading us astray. So let's go to the next slide. So this is an example of the questions that we asked them. And again, this mirrors a little bit of that question we saw a few slides back with the min-choices scoring, right? So this is a higher roll-up, but we asked, what amount of general support needs does this person need for the daily activities beyond what is age appropriate, right? And this is a question from the kids survey. So there are age appropriate supports that, maybe a parental or caregiver would be expected of for any child, in addition to those for the disability, right? So they may have low, moderate, high, or extensive needs. Next slide, please. So once we did that verification and we found the alignment, we continued on to finalizing the support range criteria as it is. So let's talk a little bit more about that. Next slide. So taking what we learned from the survey in step 3, as well as ongoing conversations and, continued stakeholder engagement, even for those who weren't able to take part in the surveying, we were able to have focus groups and facilitated conversations. And what we found really was that the preliminary criteria for support ranges 1 through 4, again, those are the support ranges really driven by that general support need, were consistent from the expert panel survey, right? Those Minnesota experts. However, what we did find too was that people here in Minnesota were more likely to assign people to support ranges L and H than the preliminary criteria. So again, in that first step, we identified that there was needs in addition to their general support needs for people with behavioral or health needs that were outside of the ordinary. But here in Minnesota, we also took a larger inclusion in that, right? So again, right-sizing the model for Minnesota based on Minnesota experiences. We also, especially with the adults, used the assignments that people were giving to help create the criteria for support range E, which is our highest level, because it was hard to understand through the data. So we wanted to make sure that we were seeing that. And that, again, is a direct influence of Minnesota experts and their lived experience coming into the support range criteria as it is today. Next slide, please. So to give a little bit of a visualization of what we talked about, this is a table that we saw a few slides ago, but with that big red circle on it. And while these numbers are the same, because we don't want to publish old numbers and new numbers and make it confusing for you and for us, to be quite honest, here's where we did change it, right? So if we look at L and H, the scores across the behavioral domains and the health domains were changed, or the thresholds were actually lowered to bring more people into those categories and support ranges to make sure that we were capturing the Minnesota scoring and lived experience. Next slide, please. So now we're moving on to step 5. We're on the last couple of slides here, but that doesn't mean that our work is done yet. But let's pause here just for a second before we move to the next slide and give you some time to jot down any questions or points of clarification that you're wondering about. Okay, let's go to the next slide. And just in case we need an update, the dog is now asleep on the couch, so there's no more safety threats. For those of you with dogs, I'm sure you know how that is. So in step 5, we are talking about how we attach the funding to these budgets, right? And I want to take a moment and pause before we get into that funding piece to really say, hey, and call out, a lot of the times when we talk about individual budgets, everybody jumps to that number, right? And that number is important, right? We wouldn't be here talking about it if it wasn't. But at the same time, there's a lot of work and a lot of thought and a lot of importance that we want to focus on in the first 4 steps, which is creating that criteria, right? Those support ranges, so that it isn't necessarily just about getting someone to funding, but helping us understand what their needs are and how those needs can be met, and how we may see similarities or differences in the needs across our system. So, but when we do need to attach funding, we used what we have already talked about today with our vocab words, service mixes. And so what this is an overall estimate of the types and amounts of services needed by an individual in each support range, right? And that's kind of a soft way to say it. And for me, unsurprising, I'm a math person, so equations make sense in my head. And so we have that visual at the bottom of this screen that I think helps clarify it a little bit. A service mix is really taking a service that we know about, determining how much of that service a person in any support range, in any living setting would need. It could be a lot and it could be none. But that amount, we roll that into hours, and then we multiply that by the rate of services, right? So it's just determining the amount of money a person with those support ranges may need to support their needs, right? And it's not just one service, it's a number of services. Those services change by living setting and by waiver, but we add up each one of those to get to the total budget. I do want to pause here and say a service mix does not dictate service use. We are using the most often used services, sometimes those with higher rates as well, or we're putting services into service mixes that maybe aren't utilized, but we want to make sure people have the opportunity to do that, like employment services. That was a decision we made in 2018. So let's talk about the next slide. So when we were creating the service mixes, we didn't just look at one thing or another, but it really is the layers of decisions and choices and information that we had. So of course we used current utilization data, and we've updated that over a few years, and we'll have to update it again. We also looked at the legislative guidance and initiatives, things like the independent living first, the employment first, and the self-direction first initiatives coming from the legislature, as well as internal policy goals. So when we first created this in 2018, the employment services as we know them today were very new. But we wanted to make sure that because they tended to be a little bit more expensive, people had space in their budgets to try those out and try on employment. And so you'll see those numbers be higher than what that current utilization data was showing us. But here's a grid, and this is just the hours on the right side of our screen. We saw individualized home supports, the number of hours a week we would assume for an individual. And just to call out, this is someone living independently. And I think for support range 3, if I remember correctly. And we also take into consideration the need for extended personal care, or PCA, for those higher support ranges. And then we move into the day and employment services, where we see some use of day support services, some use of employment services. But to call out again, none of these services are required. A person in support range 3 living independently would have the same budget whether or not they were using those day and employment services. We would have just set them aside like, oh, well, you're not using them, so you don't need that budget. It's all inclusive. This is just the mechanism with which we set the amounts of budget. Next slide, please. So a budget range example, and remember when we talked back to our vocab words, we have those support ranges and we have service mixes, and those service mixes lead to the budget range. So when we looked at that table before, we could start to roll up the numbers, and just to call out a concern we hear a lot is these numbers are really low. These don't feel correct at all. And I will say the numbers that you're going to see us use are based on 2019 rates of service. Okay, until those numbers are updated in our future work, we're going to continue to use those, but we'll continue to call it out as well. So these budget numbers are based on the service rates for 2019. And for those of you in the know, our rates have changed quite a bit since then, right? We've ended banding for the disability waiver rate system. We have had increases for PCA services. We've had increases for other services as well. So all of that would be taken into consideration with our future work as well. But as we look through it, we can see the services that we just talked about, and they're rolled up, right? We, again, using that equation, we take the service and we take the amount they would need a week and we make that out to a year. We multiply it by the rate of service, and do we get to the total of that amount? So when we're talking about individualized home supports for someone who is in the budget range 3, for a person who lives independently, that's 17 hours a week. And what that works out to is $37,000 a year. And then we add up each one of those services or groupings of services, and we get to the total budget amount, which in this case is $67,389. But because we're not looking for exact numbers and we recognize that within any support range, there is a range of needs, we moved that to the budget range itself, which goes lower and higher than the actual total budget as it's added up. And just one more time, I want to make sure it's really clear because we hear this concern often, and I want to make sure that we all heard it together. Service mixes are not determining they are not dictating, sorry, misspeaking there, which service a person will use. They are determining the total budget. And so if someone came in and they were in budget range 3 for a person who lives independently, they would have that range from 33,000 up to 70,000, and they may use none of the services that we see listed there, right? So thank you. Next slide. And I forgot one thing on that last slide, so I'll just say it here. Our intention is to bring to the February meeting a discussion and a feedback session around service mixes and those budgetary connections that we talked about. So step 5 is really something that we want to dive deeper with you all, have more back and forth, and have a discussion about how we can do and reflect what the RAC members are saying with that work in the future. So we'll dive a little bit deeper into that next time as well. Again, creating more space for a conversation. So now we're moving on to step 6, all the way down. Last step, everybody. Thank you for hanging in there. We've had our dog mishaps, we've had our misspeaks, but I really appreciate it. And again, just a reminder, write down the specific questions you have, especially with that service mix, because we're going to be getting to that at our next budget meeting in February. Next slide, please. So thinking back to step 3, we did that big survey and we did the verification, right? Using the Minnesota lived experience to make sure that anything the statistics were telling us were right-sized for Minnesota and the experience we have here. Step 6 is very similar, but in a more focused manner. So we again created profiles using real data. We layered in their budget and spending amounts, and an expert panel of stakeholders again reviewed it, but they didn't just look at it and do some high-level scoring. This is where we dug down into a person's whole file. We looked at de-identified min choices questions. We looked at all of the information they had in CSPs and CSSPs to really make sure that we weren't just looking at an assessment and coming up with an answer, but that we saw service plans and we saw all of the different pieces of their DHS information to make sure that we didn't maybe miss something, right? And so with that, we did a number of days of what's called a record review. We looked through each one of those records and we first looked to see, hey, are those support ranges lining up, right? Not talking about funding, not talking about services. Are the support ranges lining up with what we think they should be? And then we moved on from that to look at the budget range compared to the services and supports they were currently using. And was that going to be enough? Was it too much? How did that fit in together? And again, right sizing from there. Next slide, please. And again, we'll use a kid example here, a little bit more recent, but you'll see the scoring. The same thing was happening very similarly in that survey with a little bit more detail. So for this question, right, for each support area, in the table below, does that child need none, low, moderate, high, or extensive supports, right? So again, looking at those domains, we have the activities of daily living, the instrumental activities of daily living. Also talking about social and community activities. I don't know about you, but my kids definitely want to get out there and have play dates and connect with their peers. And that's a big part of growing up that we want to make sure we're encompassing, as well as sensory and communication and safety. So our group was looking through all of the profiles and making sure and scoring, and again, checking that where our analysis and our conversations have led to matched up with what Minnesota experts think. Next slide, please. Okay, we've made it through the six steps. Congratulations, everybody. I'm gonna take a break here just to have another drink of coffee, and then we are going to jump into the proposed budget methodology that we have today.
This is Leah. I'll just encourage people again, now that you've had a walk through that first section, to continue to write down any questions that you might have to help bring them to your mind when you fill out the evaluation survey after today's meeting. Thank you.
Perfect. Thank you for that reminder, Leah. It was a great option. Thank you. So let's go on to the next slide. So through that 6-step process, right? 9 steps. We came to what is the individual budget model, right? And again, that's one of our terms that we talked about, which is the model or the way that we determine a person's support need and ultimately their funding for the year to meet that support need. And what we have in front of us is our 3-pronged approach. And you can see each one of these, and I'm pretty sure that we talked about these in June as well, but each one of these things work together to make the budget methodology, but also can be individually taken out and right-sized, edited, corrected if we're finding errors or if we need to update information. So let's talk about that a little bit, right? So support range descriptions. We talked about that in step 2 of the process, but that really is a description of a person's supports and service needs, right? Using I statements, using the narrative format. I need this kind of support when I am out in the community. I need this kind of support when I am engaging in social interaction, so on and so forth, right? And this is one of the easier pieces, or the easiest, let's call it that, to take out of the methodology and adjust, right? Because it's not influencing the other pieces as much. And we really feel this is the place we're going to have the most opportunity to grow and learn and change, right? We want plain language. We want to make sure that the language we're using within these is really going to connect with people and their families. And so that is one of our 3-pronged approach. The second one is another one of our terms we talked about, the support range criteria, right? And this is the scoring of the MnChoices assessment that determines a person's support range. And this is, again, somewhere where we have additional work to do, and we'll talk about our future work. But as all of our communication about the new implementation timeline said, with the change that is coming with MnChoices, we don't want to bring out a budget model that is based on an assessment we don't use anymore. And so with the new MnChoices revisions coming out, we also have to stop and pause and make sure that the support range criteria is having the outcomes that we anticipated, as well as checking with our Minnesota experts, which in this case is likely to be you, RAC members. So we want to make sure that we're testing that and making sure that it's right size and that we're not rolling out a budget that is based on an assessment that we no longer use. So spoiler there. And then that third one is those service mixes, yet another one of our terms that we talked about, and we talked about it a little bit, and we'll talk about it in February, but that ultimately leads to the amount of funding for a person. And again, we here at DHS anticipate this is a place that will be updated frequently over time, right? One thing we heard from 2018 to today is we don't want a budget model that's going to get stuck, right? Because then someone's going to raise a rate and I won't be able to afford the supports I have today and I will have less. This is where those service mixes really become important. because not only do they work in lockstep, they're connected with those rates, right? Because we talked about when we create a service mix, we have the rate right there. If that rate goes up, the budgets recalculate to go with it. But it's also soft enough and allows us to come back and have the conversation and say, hey, has the way people use services really fundamentally changed, right? That's a conversation for this group as well as other stakeholders to have in the future. We set these budgets up in 2018 for adults. The last time they were updated was in 2020, but it was with 2019 data. I don't know about you, but my life's very fundamentally changed since 2020. Case in point, I've got a dog with me at this presentation today. So we have to make sure that not only are those service mixes reflecting how services are being used, but keep an eye to make sure that we don't get too far astray and that they still are reflecting the way that people use the supports in our system. So that's our three-pronged approach, and each one of those things can be independently changed, though we'll talk about how we anticipate those changing before our rolling implementation starts in 2026. Next slide, please. Another question we get about the budget model that really isn't about the budget model, but it's important and we need to talk about it, is the budget assignment process, right? For those who use CDCS today, we know that there's a lot of difficulty there. There's a lot of waiting and making sure everything's correct. And while we want to make sure everything's correct, we also know we live in a world today that doesn't usually wait a month for updates. So here is a really high level kind of sketch of we anticipate being the budget assignment process. This, however, I will say, is a great place of work that we have yet to determine. We're having conversations with lead agencies. We look forward to having more conversations with this group as well as additional stakeholders to make sure that the process we lay out works for people, works for lead agencies, as well is clear enough and has enough guidance around it to make sure that it's not really hard to understand or nobody knows what to do on that first day of implementation, right? So this starts, like I've said a number of times, with the min choices assessment, right? That assessment has to occur. We've got all of the eligibility, none of that's changing. But behind the scene, that support us, that min choices assessment is also scoring the questions like we talked about, which leads to a person's support range assignment. Okay, so that again, if they are an adult, would be 1, 2, 3, 4, L, H, and E. And they would have that support range assignment. And that again, we're just at the determination of the support need. But if you look to the next circle there, right in the middle, it's kind of red, is the waiver choice. And that waiver choice is where we start to talk about where a person lives and which waiver they would be on, which leads us from the support range to the budget range. So if a person is living independently in their own home, then they would be someone who is living independently, and they would be using that table of budget ranges. And we would look to their support range to figure out where their budget range is. So after waiver choice comes budget range assignment, which is that second circle there. But once that budget range is assigned, we go straight into support planning, right? We're planning to that budget within the limitations it has, and we move on. But again, calling out that not all services are within the budget itself. So there may be additional conversations we need to have around the support planning. It's not just to the budget, but creating that whole support plan for the person and their needs where they are. Next slide, please. Okay, so now we're going to jump into what's next for the budget model, talk a little bit about our timeline as well, but I'm going to take a pause here to again remind you, write down any questions you have about the budget model, about what we've talked about. I just did 2 slides, but there was a ton of information in them and a lot of things I said. So take a minute to write that down, and I'll ask us to go to the next slide. Okay. So what's next for the budget model and the individual budgeting in Minnesota is recalibration. And what that really means is that we need to take that three-pronged model that we developed and make sure that it fits today, right? Like I talked about, each one of those things can be pulled out and looked at individually, but given the time it's been, as well as the fundamental change with min choices between the current and the revision, we really want to take a stop and a pause and make sure that the decisions we made and the data that we have reflect today's Minnesota, or really future Minnesota, right? And just to talk a little bit more about that timeline, we at DHS anticipate that we can begin the work of updating that support range criteria, the service mixes, 1 year after the launch of Mint Choices. So that seems really far away. We're talking about 2024 in that case, and we'll have a timeline in a couple of slides to orient us all. But really, as we see it, the work is not going to stop. There is so much more opportunity for DHS and stakeholders to continue to examine the methodologies and the decisions that we've made, as well as prepare for the policies and the procedures and the things that people are going to need to make sure that this transition is as little disruption as possible. That a case manager knows the choices they have in front of them and how to talk about them with people long before we get to 2026. We really are anticipating that you, RAC members, are playing a large part in all of this work, and especially in the development process with the recalibration. So let's talk about that a little bit more. Next slide, please. So here's our friendly 6 steps. They're back again. And really where DHS is coming from at this point is that entire process needs to happen over again. It's been a number of years, and we've had a lot of major changes in our system and in our world. And so we anticipate, starting in 2024, that we will start the 6 steps over again. And you can see that a couple of these steps are kind of grayed out. And really that's to highlight the different areas where we see RAC members being our front and foremost partners with this development, the things that you as members can participate in and hold us DHS accountable and make sure that we're bringing all of our shared voices to the conversation. So step 1, create support ranges with the analysis of min choices. I bet you can barely make that out. That's something that we're going to have to do internally, given, private health information and the complexity of statistical modeling. But that doesn't mean we aren't going to bring those findings to this group, as well as other stakeholder groups, to talk about them and say, hey, here's what we're finding. With the min choices revision data, we find that the support ranges generally hold true. So then we would move on, right? Or we'd get some feedback from you, or you all can have those conversations with us. And then hopefully we would move on to step 2, which is the development of support range descriptions. Of course, we have some to work off now, but they may be different. We don't know yet until we have the space to do that analysis. And then, of course, a really strong point for this group will be working with DHS on the verification, right? Both in step 3 and in step 6, as much as possible, bringing your voices and your expertise into things like a support range survey, making sure that the scoring that you have would match out with the scoring that we've found. So I'm going to pause on this slide for a minute because we've talked about each one of these steps in detail, and I would encourage you to know where are the places you're excited about engaging in this conversation. Where are the places you want to see more or learn more about before we get to it? Any of the things or the questions you have about that recalibration process and how you, RAC members, are going to be partners with us on it, I would encourage you to write down. Okay, let's go to the next slide, but keep writing. Another thing we've heard from you, RAC members, is that you really want to know what's set in stone, what's changing, and where are those decisions, right? So we just talked about where those decision points and collaboration points are with our 6 steps, but a little bit more to talk about what we anticipate at DHS changing and staying the same. Again, because that kind of helps us all have a shared understanding of where we think we're going together. What's likely to stay the same with an updated budget model is that there is a support range framework, right? Going back to June, we talked about that level-based budgeting. That is not likely to go away here. That was a period of study, and stakeholders as well as DHS determined that was the best way forward. So that support range framework is not likely to go away. The service mix frameworks, not necessarily the specific frameworks or services themselves, but that framework of using services and utilization and rates to create the amounts of the budget ranges would stay, as well as the use of the min choices assessment to assign a person to a support range. Of course, we go from the current min choices to the min choices revision, but the min choices assessment will continue to be the way people are assigned to a support range. Some of the things that could change, and this is a limited list. I'm sure we could all come up with a dozen more things to put here, but the number of support ranges could change for adults or for children. We may have new information we didn't have before or new clarity around that information. So while the level-based budgeting system will stay, we may see that groups of support needs hang together with 5 ranges for adults or 10. Who knows? We have yet to see and do that analysis. The age ranges for support ranges may change as well. Right now, the kids are in 3 cohorts that are 0 to 5, 6 to 13, and 14 to 17, but we may find meaningful differences in the new support range or having more, or in the new min choices, I apologize, or having more kids in the system than we did previously as well, which continues to be a growth area. Like I said, the service mix framework isn't changing, but the exact service mix amounts, which services are included, the rates, those are very likely to change, right? We knew that those were going to change even if our support range criteria didn't, because we've had a huge change in our system. And then also what could change and is likely to change is the exact items used in the min choices assessment. And that's a big piece of the work that we have to do with that step 1 of recalibration, is determining how the new questions of min choices may be different than those previous, or how they're coming out with different outcomes as well. Next slide, please. And I see a question from Kelly in the chat about asking and answering questions today, or keeping track of them, or putting them in the chat. We ask you're keeping track of your questions separately, but this is my last slide, so we do have a good amount of time to answer some questions. So while I'm going over this, if you do have a few questions or things you think other people may have questions about as well, I'd ask that you put them in the chat now, and we will do our best to start getting to some of those. Of course, given how knowledgeable you all are and how many questions you have, we may not be able to get to them all today, but we will do our best, okay? So if you want to put those into the chat now, you can, or we'll have some time potentially to come off of mute. I do ask, however, that you are detailed with your questions so we make sure we're answering the question the right way. So while you're doing that, I'll go over kind of our budget topics and timeline here, right? With our new extended timeline going all the way out to 2026. Let's talk about what we're going to be working on, because I did say, right, we aren't going to be working on that recalibration work until 2024, but we are not letting the grass grow under our feet anytime soon. So, 2022 is almost done. If you haven't heard, we're almost into November now, so get your holiday preparation ready. But in 2023, we're going to continue the development of policies and procedures. And when I say that, I mean all of those pieces of the puzzle that support this transition, as well as all of the people in our system through that transition, right? Talking again about case managers knowing what services, knowing the decisions have to be made long before day 1 of implementation. We're also going to continue to look at the budget exceptions, self-direction, and communication planning. We know a big question right now is what happens to people who have spending today that is more than their assigned budget range. And that's where budget exceptions come in. We're continuing to do that work. We're continuing to partner with stakeholders, and we're hoping in 23 later in the year that we can bring that to this group as well. Looking at 2024, we're continuing for a good portion of the year that data collection for the min choices revision. And then around the middle of 2024 is when we anticipate starting our 6 steps of development. In 2025, we'll work with our partners on the waiver policy team here at DSD, who are also working on the waiver shaping, pardon me, to submit the plans for these waivers with CMS, right? There is a role here for budgeting to be part of that process as well. And then hopefully really hitting the ground running with trainings for all stakeholders, including people and their families, lead agencies, providers, so that every facet of our system is ready with the information they need to the best of our abilities to go through this transition, right? Oftentimes we focus on our lead agency partners and making sure they have the tools in their toolbox to do this. However, we want to make sure that people and their families also have the same tools in their toolbox and that our providers have those tools as well. So it's a big focus of 2025, in addition to finishing up the recalibration work and making sure our budget model fits our new assessment, as well as the reality of our services and supports as they are today and in the future. And then in 2026, we launch a rolling implementation on January 1 of 2026. And that rolling implementation means a person will roll into the new waivers and budget model at their assessment, right? Their annual assessment. So if you're someone who doesn't get their annual assessment until October, then this is not something that's going to come up for you until October, unless of course you need a new assessment and you have had a change in need. So I've seen a number of questions roll in. I'm going to take a moment to pause and look at them, and we will start to try to answer them the best we can here in just a moment. So again, if you've got more questions, please jot them down in those notes. We're going to ask for them in the evaluation that comes out in the coming days.
Megan, this is Leah. I fully appreciate some of these questions you might be able to answer today, and others you may take into consideration for future meetings. So just sort of letting everybody know that although you might have encyclopedic knowledge, that you might choose the questions that you're able to answer today, and then, as we've done in the past, gather up some questions for future answers.
Yes, thank you very much for calling that out, Leah. I appreciate it. And you know what? The first question I came across is one of those, because I see that Trisha asked to hear more about charting the life course. And I know very little about it, but I do know, and I can see here, I will put it in our chat as well, that our Disability Hub MN has a lot of information about this. This is a tool that Minnesota is using. I've seen it in action. It works really well for planning for people and planning for a whole life as well. So I can put that in our chat. But I don't have encyclopedic knowledge about that, like Leah said. So I don't want to speak to something or misrepresent anything. So 1 second while I put that in the chat. And I will keep
Just wanted to
reading.
clarify, that was not my question.
Yep. So I see that you said, I would like to hear more about how the charting the life course has been or is being used.
With this process, not what it is or how families use it. Sorry about that.
No,
it's
don't
okay
worry
if you
about
don't know.
So I will say again, I've used it in a very specific way with our vendors as well as with stakeholders about how to use the different domains within that to identify our support range description domains. But with us really looking at it, we use some of the source material from Charting the Life course to learn more about the domains, as well as, and I want to say it's called the STAR chart. We really started to look through that and bring that into our discussions. I don't know how to adequately jump into like every piece of the puzzle that we've used that as, but it has been a guiding principle for us to continue to look and come back to make sure we're not falling too far off of course of how we're talking about these budgets or the decisions that are being made, as well as, you know, the overall support planning for people. Okay, thank you for clarifying that too, Trisha. I really appreciate it. So I see a question from Dawn Barnes, and it says, looking at the budget assignment process on slide 41, the last circle talks about support planning. Who is on the support planning team? How does that differ from today's process? And that's a really great question, Dawn. I think what I can say to that, which is not a final answer, is that we anticipate as much as possible maintaining the support planning process as it is today. But this is also a place of work for us in collaboration, both with the support planning process that is out there today and how we're doing that work, as well as with our support planning team here in the Disability Services Division, making sure that we're not stepping on each other's toes and that we're really collaborating policies and procedures together. My intention is coming from the budgeting perspective is to not disrupt that process as much as possible. And I'll say even in the last few weeks, we've been talking to frontline staff from lead agencies to learn more about what they're doing in the support planning process, what things they need from us. So that's something we're working on right now. So more to come in 23. I see a question from Pat that says, please define L, H, and E. Those are the names that we've given to the support ranges outside of the general support need ranges for adults. They're just the letters that we used. I think they are based mostly off of low general support need, high general support need, or extraordinary need. However, we're not tied to those. If you have a great way to name these support ranges, I'd love to hear about it. What all three of those have in common is they have layered on additional funding as well as identified support needs for behavioral or health or both, right? So someone who is in a support range L has low to moderate general support need. They would mostly align with like a support range 1 or 2 if we were looking at just their general support need. But then they also have support needs for maybe a health condition. So we can recognize and see that a person is going to need more supports and services if they have a health need or if they just had general support needs. So we layer those on. See a question from Jennifer, and it says, why is the budget model favoring residential service providers? And we will talk more about funding and how each one of the service mixes were developed over time. But I know that's a very common thing that we hear and have questions about is the favoring of residential services. And let's save that and table it for next time, not to avoid the question, but because I really want to be able to dig into the service rates and how those services are paid for differently than the in-home supports, as well as some of the decisions we made. And again, thinking back to our recalibration work, that's also a conversation we get to have again and bring to the table. So let's table that and talk about it at our next meeting where we can really dig into the services and the supports, as well as how those funding decisions were made. Okay. I see a question from Pat, and it says, who's deciding beyond age appropriate? And so this is a very gnarly knot that we have been working on for years here at DSD, long before this conversation, but it is the conversation about parental responsibilities for children, right? And so to say this in as plain language as I can, I know I've got a 6-year-old at home, and she's a fiercely independent 6-year-old, but she still relies on me as her parent or parental role figure to support her in some ways, right? She's really great at dressing herself in funky ways, but she doesn't do laundry. And so there are roles, and this is something we've talked about with just about everybody in DSD, lead agencies, as well as people and their families, to say, hey, if someone, a child is receiving services, there is some level of support that we would anticipate coming from the parent as part of the parental role, not as a caregiver to a person with a disability, right? Someone who is 2 years old has a different parental responsibility than someone who is 14 or 15 years old. And so that is something that we've worked with our partners and to determine. Some of that's already built into MinChoices, as well as the experts we had working on the support ranges for kiddos were all people who have lived experience with supporting kids. So that was a conversation there. Again, however, if reading through materials and you find that maybe you would have a differing opinion of that, and again, we are talking for the 17 and under population, it's a great thing to bring to our recalibration conversations and flag, especially in the questions for us. Make sure we have that there, okay? Just moving down my list here, everybody, and I would ask Alliant, our facilitators, to make sure that we're flagging the time here. I'm just going to keep working through our questions. I see Jennifer.
You're at 11:20 right now. So
perfect. Thank you. I'm trying to. I got lots of screens and everything going on here, so I appreciate your support.
I'm sure.
I see a question from Jennifer about exceptions. And like I said, we're gonna, again, great question, a question we hear frequently. Let's table that because that's a conversation we're gonna have it hopefully in 2023. Come to you all with proposals of how we see the exceptions process working, when someone may or may not need an exceptions. We're also doing some pretty heavy work right now with our partners in DSD who work on the rates for these services because there's also rate exceptions, and those two things do need to be aware of and work together. So I'm going to table that one as well. Okay. A question from Amber, and this is one we get frequently as well. What would budget or budgeting look like for consumers who might go from an independent housing and then to residential housing and then maybe back to independent housing all within a given service year? This is a great question. And this is, again, one of those reasons we're partnering really closely with lead agencies on to make sure that we understand the times that that's happening and also get the feedback from them about how we can support that process. So what I'll tell you is what I know today. And again, I don't know all of it, and support planning isn't necessarily my extreme place of knowledge. So what's been tentatively decided today, but isn't set in stone, is we don't anticipate there needing to be a MinChoices for those waiver changes, right? Because what you're talking about in the new setting would be a waiver change. However, beyond that, the processes really have not been figured out. And I don't want to speak too deeply to them just because that's not necessarily my area of expertise. And I don't want to misrepresent work that maybe I don't know about today. So again, that's a great one to put in your questions so we can send that off to our partners here in the Disability Services Division to make sure that they're continuing to work on that. I'll say I know they're working on it, but I don't want to represent their work in the incorrect way. So I do see a question here from Pat about quality control for MinChoices. While I'll preface and say I am not a MinChoices expert, that would be the MinChoices team here at DSD. Can you elaborate on your question a little bit, Pat, so that we know what to bring back?
Yeah, hi, sorry. Yeah, so for example, a few years ago down in southeastern Minnesota, they had quality control teams of people. I think they wanted to, at a time, to go to, people who were using waiver services and meet with them and their support people and whatnot, but independently from them so that they were hopefully getting any information that was beyond anything that might have been going on that would have been missed had everyone been meeting together. So I'm just wondering, so in terms of like the quality control, so people, because we've heard on these meetings, people, for instance, that had a mid-choice assessment done, and then she lost several $1,000s, but then the next year she had a lot of medical documentation, and then it was back up what it was before. So I know you're not doing, min-choice information and whatnot, but I'm just wondering, there's not even there's the issue of the min-choice assessment, but then there's also the person that's doing it. And so those can be, it can be multiple levels of things that may fall through the cracks or be missing. So I'm just wondering if there has been any discussion about changing that, or having more training about what that is, or some way of having accountability, or if people that are having the assessment done can, appeal it. So that's kind of where that question came from.
For sure. And, I'll preface by saying, like I did before, this is not my area of expertise. So I don't really want to jump into most of those questions because I don't want to misrepresent really great work that my partners here in the disability services are doing. I know we as a division really are looking at quality improvement and having those conversations as well, both around this effort and really looking overall, right? Which doesn't get to the specific min choices question. What I can share with you is I know that when we passed Waiver Reimagine in 2021, what was also passed was what is called a reliability and validity study for min choices, and that's ongoing, which would look at testing and making sure that the outcomes we anticipate that we would have are happening. And that is really technical. We can spend some time on it. I think in a future meeting, I can point you to the documentation as it becomes available. But with the min choices shift to, that's a little bit in the future. Beyond that, though, I really hesitate to touch too many of the things. I know my partners across the division are working on a lot of different things, but I don't know what I don't know well enough to say and speak to it. But we'll take it back. And again, I think what we continue to hear is our min choices partners may have space in these meetings as well.
Yeah, thanks. I appreciate that. And I'm actually on that committee and we've had some discussion there, but I just wondered, like what your take on that was. Okay, thanks.
For sure. Well, Pat, do you want to give us a quick run? No, I'm kidding. I'm kidding. But I mean,
what did I say? I'd have to think about it and how it would make sense to communicate to this group. But I'd be willing to do that in the future.
Perfect. Well, thank you. And I'm going to note that down. Don't you worry. Because yeah, it's and we start to see that really quickly, right? We've had questions about support plan. We've had questions about min choices. We have questions about quality, and all of that creates a really big web. And we're all talking and we're all collaborating together, but sometimes we want to make sure that we're not misrepresenting each other's work too. So sometimes we're like, oh, no, hold on, come and talk. So I appreciate that. So thank you, Pat. I see Katie's question. The services listed under the current waivers, who determines who is eligible for what services, and do they take away from a set service budget, or are they in addition? And can you explain that a little bit more for me, or what your question is, if you could repeat it? Katie Barton?
Yeah, I'm typing it back in the chat.
Oh, okay. And I'm sorry, I'm not at that point in the chat, so we will circle back to that one there. A question from Don: what stakeholders are you working with on the budget exceptions proposal? Who haven't we worked with? We've been working on budget exceptions now for about 18 months. The main people that we're working with right now are lead agencies to help determine how that process would work. In the past, we have had a working group that was mixed between lead agencies, advocates, providers, people and their families. I think I'd have to go back and look again. Digging into some of the needs and the wants from that process as well. So again, really wide. We're almost always going to be really wide with our asks, and where that process is right now is potentially some more need for conversations with lead agency staff just to learn more about how they're making those decisions, how we could support making those decisions around budgets. But then we also need to come back to not only this group, but probably some larger stakeholder groups to make sure that what we hear from them is being reflected, right? We've heard lots about what people want from budget exceptions over the years of this work, but making sure that we're reflecting that and also able to do it, because sometimes we do run up against that, pizza metaphor, to bring it back to the finite amount of funding that we do have. Okay, and I have a question here from Phyllis Breller. When the budgets are partly based on where someone lives and more people are moving to self-direction, will the rates used to be multiplied to get a budget to take into consideration the ability to pay people they hire enough to get benefits? I know there are overhead expenses for providers that include some minimal benefits, and I believe that they should be allocating those to self-directing. So Phyllis, I think what your question is about is self-direction budgets being adequate, and how spending and costs are different across the state. Is that what you're getting at here? Or if you could elaborate, I'd appreciate that.
Not even across the state. I think I'm on the NCAP's on that as well. The National whatever person center, whatever it is. But a lot of our dialogue is getting self-directed budgets to people, and there's a lot of, and I don't know what the other states' budgets look like, but getting the same budget to them. Now, I understand that there are overhead costs that are beyond benefits and stuff that providers need. However, I don't really feel like our budgets, our current CDCS budget certainly doesn't allow enough money for them to be able to pay somebody enough to either include and pay for benefits for them or give them enough that they can purchase their own benefits and be competitive with other providers and other businesses. So when you know how we have that formula, will it take into consideration what it costs for benefits and stuff too? Because I mean, our self-directed people, they need a budget that they can compete and get the right people working for them. So that was my question.
Perfect. Thank you. So I'm going to give you the easy answer, and then I'm going to put my rates hat on for a minute to talk about that a little bit more. Okay. So the budgets, as we have developed them, the individual budgeting model, all budgets will be the same. Everyone will walk into an assessment. We talked about, right, that the steps that we talked about with support planning, but there was never a choice in there for someone to self-direct or not self-direct. So a budget range is a budget range, whether you self-direct none, some, or all of those services. So that already takes into account equity for those two things, right? So if we have assumptions about benefit costs as well as worker wages and all of that, as well as overhead for our rates, which we can talk about in a second, and we do, spoiler alert, then that would also transfer over into the self-direction lane, in that we're using those rates to set up the service mix and ultimately the budget amount. Okay. So a person's budget is the same, whether they self-direct. I'm just going to say this again because we see it a lot and we still get this question often too. A person's budget is the same, whether they self-direct some, none, or all of their services. Okay. So that already takes into account of equity that I think we've heard reflected back that a lot of CDCS users don't feel is there today. Okay.
Wonderful. I agree that message needs to be loud and clear. That when you were talking about all of those different services that you plugged in, that you were looking at provider rates and stuff,
Yes.
when you were figuring that, and they will get the same budget. So, okay, thank you.
And for those of you on the call who may not have Phyllis's experience, and I just know she's got experience because her and I worked together for years at this point, the rates that we use to set the service mix is up, right? We talked about that. The state has rates for those services. That's part of the function of Medicaid, of course. But those rates themselves, and again, that's a great place of collaboration for us to talk to that team who does rates. But having been on that team for a while, I know they include a lot of assumptions about costs. And it's not just this is the rate we pay, but they include things like what a worker's wage might be for that service or like services, right? If we're talking about self-direction, it builds in costs for benefits as well as overhead costs and any other sort of supplementary costs that have to do with the provision of that service. So Phyllis is correct in saying that we may see a disconnect in our conversation and we can call it out better in future meetings. So thank you for that, Phyllis, in that we are using those, what we call today traditional services to set up these service mixes. But that is the clearest pathway forward. Smash my words together here, guys. It's the clearest pathway forward in a way to set up the budget amount, similar to how those service mixes do not dictate what services a person can use. It's just the most frequently used services and rates and all of that are going to reflect the cost of those supports in the most standardized way possible. So yes, when we talk about self-direction, the budgets themselves are being set up with those traditional services, those provided services. Sorry, that wasn't good. But overall, it's creating space to determine the amount of funding. But ultimately, if people choose to use them for self-direction, just like if they chose to not use any day supports or employment, that's a choice in the support planning process. Okay, and I see a question from Pat. Which of the 6 steps does developing services fit? E.g. Peer supporters. So again, I'm a little bit confused by this question. I think I might know where I'm going, but Pat, can you clarify your question for us? Pat, right? Are you there?
I am, sorry. I got a different phone, and even though it's the same, it's, yeah.
Just slightly different.
Yeah.
Yeah, understand.
Yeah, just different enough that I have to play around with it a little. Yeah, and I keep asking all these questions. I don't know, I appreciate people's patience and whatnot. Sometimes I'm really on with what's going on, and other times I'm more of a listener. Yeah, so the peer supporter. So my son is in a residence. Actually, it's I think more of a DD residence. There's only 3 of them, but it works well for him. But down the road, he may be either living independently or possibly with me. We'll see what happens. I'm also on, CDCS. So when I think about the kind of services that he would use in the community, assuming, say, for instance, he's on self-direction, peer supporters would be, really helpful. And yet, I have looked around for peer supporters, and I know the state has done trainings on and off for peer supporters, and then somehow they dissolve after a couple of years. And now I think somebody has to have a job lined up in order to even do the training. So I'm just wondering, because, and maybe I'm wrong, maybe there are peer supporters out there in the community that are, doing that. And obviously, I don't know everything and whatnot. So I was just wondering, so for them to be covered as a service, where that would fit in those 6 steps that you were talking about previously. Would that be like developing the service? Is that versus like the mix of services? Because if it's not out there, then it's kind of more developing the service, but I'm not sure if that's what that meant.
Right. And, I'm not the service team. So I can't really say,
Okay.
oh, that is, or that's how we do this, that, and the other thing. So I don't know about the peer services. That's not one that I'm aware of. But what I can speak to is the development process of a new service, and that really comes into the conversation around the service mixes again. In that, if we are bringing new services or new rates on, part of that conversation in the future in a budget, an individual budget world would have to be, where does that service fall? Does that service fall within the budget, outside of the budget? How do we work it in, or how do we add additional funding if necessary to a budget to allow for people to spend on that service? So that's what I can speak to on that. As far as that particular type of support, or what may or may not be happening there, and on which waiver it would be, that is not my domain, and I can't answer that question for you today, but we
Sure,
can
sure.
take it back.
Yeah, no, I appreciate that. I've been advised to look for other, you know, places, maybe in other states and whatnot, to see it, just to get some research about what's already happening out there. And so I just wanted to see if I was on track in terms of how that might fit into, you know, the 6-step process, since it's not a service that's already being offered, to my knowledge, at least in the community. I mean, they're in residential places, there are peer supporters, but okay, so it might be a service that would need to be developed, and then the whole budget rate and the people and whatnot would go from there.
For sure.
Thanks.
Thank you. Sorry, and I apologize. I do not have encyclopedic knowledge about everything, but we can take them back. And we have lots of partners here who are just so excited about this work. So
No,
I
thank
think
you.
I've gotten into some of the response places in the chat, so I'm going to try my best to filter through these. If I missed something, please come off me and represent that.
Megan, this is Leah. I think the next question after the responses and then the link to charting the life courses from Jennifer Durgans.
Perfect. Thank you very much. That's very helpful. And just to read that for everybody, if you're not following along in the chat, people have deep concerns about how certain aspects of their budget will move outside of their budget. For instance, nursing services. How will that be addressed in a way that provides more clarity and, frankly, comfort in ensuring that they'll be able to continue the services that they are necessary in a person's assessed needs? And Jennifer, again, you are hitting on a topic that we frequently hear about and are continuing to have conversations about. We often get questions, what's in the budget, what's out of the budget? And unfortunately, the answer for us, we can tell you what we assume, but we don't know the outcome in the future. I'll say, especially that nursing conversation, we have a lot of stakeholder engagement happening around that right now. So I don't want to go too deep into it at this point. But again, it's something that we're anticipating bringing back to this group as those decisions and feedback opportunities come. So we know, especially the concerns around nursing and the nursing shortage and all of that are already in the conversation. So again, I'm going to table that one only because I don't want to speak out of turn for the conversations that are happening and I may not have been part of at this point. Okay. But thank you for bringing that again to this conversation and making sure that we continue to hold each other accountable, that those conversations continue to happen. See, the next one I think is a question, but Kelly, if this is a follow-up, please let me know. It's from Kelly. And it says, my question is regarding a waiver choice being dependent on where a person lives. I think we have to be respectful that living independently doesn't really mean living independently. It means a person may be successful because of the supports they are receiving. For those using CDCS, I want to be clear that they'll remain an option for all participants, no matter where they live, independent, home, or in a corporate sponsored home. CDCS is the true model for consumer choice, flexibility, and person-centered care. It really supports our Minnesota Olmstead Plan language. So I don't see a question there. Kelly, if you want to come off mute and clarify what your question is, I think you're correct. And thank you for bringing forward as well that self-direction is available on both waivers. And so if a person is in a residential setting, they aren't necessarily able to self-direct their residential setting, but other supports and services. And again, the self-direction work we have is still in front of us, and that's a lot of development we have. But I don't know, Kelly, if you'd like to come off mute and elaborate on the question you have that I can maybe.
Yeah. So that is the question. The question is, is some sort of a CDCS model still going to be available to all consumers, because I think that's what I'm hearing is we want to offer more choice for everybody, no matter what waiver they're on. And right now you can only be on a CDCS waiver if you're under, the developmental disability waiver. And I think it'd be great for all people. But yeah, that is my concern. If the person's living at home with parents, or they're living in an apartment with supported services, or if they're in a group home that's, corporate sponsored, everybody still has needs, and they use their CDCS money in different ways to support the needs, especially if a corporate sponsored facility can't give them everything they need. So I just want to really hope that we don't lose that option for people, because it really is the best way to allow for flexibility, independence, and person-centered control, or choice, I guess.
So I'll preface and say that a lot of that self-direction work and the policies and all of that is ahead of us and is extremely collaborative on our side with DSD, and making sure we have the people who are doing or are supporting CDCS today, and people around services and around the budgets are all coming together to have those conversations. But as it's been proposed today, you're correct. Self-direction continues to be, self-direction, that budget model, as well as the employer authority, continues to be something that people should be able to get on both waivers. But I do want to make sure that we're clear here, and I'm a little bit putting on a service hat. So this is just me, something that I've had conversations about, but that we aren't duplicating those services, right? And that's a big question around residential settings. So what are residential providers supposed to be providing, and when a person can use self-direction within the residential waiver? That's work we have ahead of us to do to make sure that those guidances are clear, and that we all know. It's just so we can't, again, duplicating services is something we cannot do. Services and supports, if that makes sense. But hear you, and yes, it is something that we anticipate being on both waivers and being available to people.
Thank you.
Yeah, not a problem. Sorry, I'm jumping around here. I see one from Lauren. I'm gonna bend down here and get some water. You guys are putting me through my paces today.
And Megan,
yes.
this is Leah. I just want to be sure, we did have Kate Barton actually write something back to us, so I want to be sure that we're able to circle back to that question when you have time.
Sure, and can you?
It's at the bottom of the chat. They wrote that there are a long menu of DD services available. And their specific question is, I'm specifically asking about what is the home delivered meals. I live at home, but I purchase my own food and cook my own meals, but I just had to start a special diet. And they had listed a whole list of DD services that were available on a menu.
Yes, okay, I'm seeing that now. Thank you. And unfortunately, I can't directly answer that question. This is mostly a support planning piece. And if you have questions about services, I would suggest you talk to your case managers. We can bring that back and see if we can get you a clearer response, but this is really outside of my wheelhouse to be able to adequately answer it and make sure that I'm giving you the information that you need. So I can't necessarily answer that, and I don't think I have any of my partners on the line right now who can from DSD.
Hi, Megan. This is Maria. I'm here. Hi, everyone. It's Maria. I use she, her pronouns. I'm on the waiver policy team. Kate, we will take that offline and do a one-to-one conversation with you. So look for an email from, I believe Leah is going to send you, Leah Zolakevich is going to send you an email about that. So we'll connect with you offline.
Thank you, Maria. It's a great example of how having partners in the call is so super helpful, and how many of us at DSD are working on this these days. Okay, and I did want to leave about, I think, 5 or 7 minutes for us to wrap up. So that gives us about, it looks like 4 or 5 minutes left. I know the next question I had on my list right here was from Lauren Thompson. So let's tackle that one. And I think that might be the last we have for today. And she says that I have a lot of questions and some others have had. As the questions are answered, I asked that if we're intended to be partners, I feel like there needs to be more clarity on how specific feedback is being used, the cycle of communication and the points of contact as we go forward together. Thank you. And Lauren, we have heard you guys loud and clear. That is something that we have heard from you all meeting after meeting. And I tried today as we went through to call out the places where we've heard questions for you and how we were reflecting back answers. But I'll say for us in the budgeting realm, what we are looking to do next is to dive into, and this is something we'll talk about hopefully in February, around some of the support decisions and the service mix decisions that we've used. And so for us, let's talk about that a little bit more. You're going to give us feedback on what you think is included. You're going to say, hey, we think this should be included or that, or this decision should have been different, or here's how my lived experience may influence kind of what you're hearing, right? Those are all lanes of conversations that I anticipate to hear at our next meeting around service mixes, around the budget amounts. I know we've tabled a couple of questions around that as well to bring back to that conversation. And it's kind of, I can see where it's confusing because sometimes it can be murky because those conversations lead to decisions being made. But again, as we talk through our 6 steps, that's a decision that gets made on step 5, the supports and which services we're using and all of that. So that feedback isn't necessarily something you're going to see reflected the next meeting. It's something that we're not going to see reflected back for a year or two, but it helps us understand the values that we share as well. And if there's a way for us that you would like to see us kind of reflect back the values or the things that we're hearing, we can work on that. That we can bring to the entire process, right? So if we really hear something about X, knowing that before we even get to step 1 of our budgeting process helps us kind of keep that in mind and helps keep bringing it back when we have those points of collaboration, like we talked about a few slides ago, right? Where are those places in the process we see our RAC members being with us step for step, as well as keeping that in mind for when we get to step 5. When we are talking about those decisions together, we can bring that back. So it's really difficult because this is such a long process to say we're going to have a conversation about something in a couple of months. And it's also a learning opportunity for me and our team and for you all, but also a place where we have findings and we have directives from you all that we take back and we can reflect those in the legislative report for sure, but then it doesn't really come into the work until a little ways down the road in a really concrete way. Of course, we know about it. We can reflect that in the decisions and how we bring things to you all. But ultimately, sometimes that's not going to surface until well down the road, which can make some of that difficult. It feels like we take things back and then you never hear about them again because it really is. That next step of that work is years in the future. So with that, I think we are just about at time, and I wanted to give some space here. I'm going to cover the slide we have in front of us, and then I think I'm going to hand it off to Alliant. I'm not 100% sure. All of the questions that came in the chat.
That works fine.
Perfect. Thank you. All the questions that came in through the chat today, as well as the ones that continue to come in the chat, whether we got to them or not, are being captured. And if we are going to, we'll respond to them individually if we can. Via emails or frequently asked questions. Calling out Maria is going to do that one-on-one connection that we just talked about. RAC members can also submit their questions via email, and there's our email address. I know it was in the chat from earlier as well when we talked about Hannah moving to a new position. And then our evaluation survey will be sent out shortly within the next couple of days, we're anticipating. And that is where we're going to ask you where are the points of clarity, let us know what your additional questions are. And then if we really are seeing a lot of questions about how that methodology works, right? Not necessarily what is this budget amount or all of that. We're going to talk about that next time. But the methodology, we may hold some office hours in November, or with the holiday, it gets a little messy. We might do that in December as well. So more to come from us. But I hope you guys took all those questions down so you can bombard us, because that's how we learn too. So I will say next slide and hand it over to Leah.
Thank you, Megan. And thanks everyone for your questions. There was another question from Lauren just about capturing the questions and sharing that information with everyone. So I do want to reassure people that we do capture all the questions from chat, and that there will probably be a variety of channels that answers come back via the frequently asked questions, updates to the website, and likely, as Megan said, if there are many questions about methodology, there will be office hours and or some questions may be addressed in future sessions. So please just know that all of your input is considered. Here's some reminders for future meetings and reimbursement forms. Please be sure to get those in for today's meeting if needed. Our next meeting is going to be Thursday, December 15th, and the topic for that meeting is reshaping waivers. We'll have a longer meeting at that time. And then the next meeting after that is February 23rd, when, as Megan was saying today, the topic is going to be service mixes and budget amounts. So it's just up to me to say thank you to everybody for your time, for your input, and for your considerations. We'll keep the chat open here for a few minutes, but if you do have additional questions that haven't been put in the chat, please send them into that email so we can keep track of those and determine whether office hours are needed in future. Thank you all, and have a good rest of your day and week. We appreciate you.
Hi, this is Kelly. Can I clarify the reimbursement form?
Sure.
So Hannah used to email them out after the meetings. Is that going to be done by somebody else, or do we just need to get a blank form and email it to the new email address that you guys provided?
That will still be done.
So somebody will be emailing them out to us?
It should be coming from the Waiver Reimagine inbox.
Okay, awesome. Thank you.
Yep, thank you.
Thanks. Have a great